12,
Roll,
please?
Dave.
You want to get a 10 by 12? 10 by 12 for hip. Do a left hip, please.
My left hand. Go from there out. Alright, sir, I need you to hold still, please. You're okay?
What's the SI?
Yeah, I know you're in pain, but we're gonna get you out of here as soon as possible, okay?
RT says it's easier if the side you're working on. Forgot to ask him the name.
Oh,
Okay.
Good time.
Alright, so you want a left hip, Mr. Chase?
sure.
Alright.
Okay, did you just see what he did? He took the time to center to his IR, and then he moved his tube. You just.
No, but I'm gonna verify before, I take the picture.
But you're wasting time. Right? I mean, if you, with the floating top, center your tube to your film, leave it alone, close it up. Don't touch that anymore. Move your patient.
Have you move your hand, sir? Sure. Thank you.
Don't move, Daniel.
Okay.
What are you doing?
I don't know, Mr. Cheese.
I know. What are you doing? You're looking at this, and yet this is moving all over. What are we doing? Come on, guys.
Okay, hold on.
Push the table out of the way, man.
This is not cool.
Tell me about it. Alright. Well, the light's not coming all the way over here, so I'll
Why? Slow down, David. Slow down. Look at the tube, sir.
Open the column.
Look at the SID.
Nice. Come on.
Bring it up.
There's a button on your button that you can move.
Excuse me, sir? Look at this. Look at this tube. Is this angled? Guys, be very, very careful. Come on.
There?
I don't know. Is it angled? I can't see. I'm over here. Okay, now you can do this.
So once I get that, don't move that. To move the tube, then I can move the tabletop.
Okay.
Yeah.
Alright. Alright, so can I have you place your hands to the side, please?
That's awesome.
Great, thank you.
Be very careful when your patients put their hands under the table like this because we run over their fingers. There have been lawsuits. Okay, just FYI.
Alright, sir, I'm going to palpitate your hip.
Can you imagine just doing this and you have a female patient? I'm gonna palpate your
It's
hips.
not a female. Why
But
are you going there?
still,
Why are you going there?
he's wondering. Relax.
I'm all up program.
Alright.
I have concerns. I'm telling you, I've got concerns, guys. We go
Alright,
out,
sir, I'm going to palpitate your hip just to find out some certain landmarks, okay? It might feel a little invasive, but it's part of the procedure.
It's not
Okay?
invasive.
Okay. Alright. Alright.
Why are you using encyclopedia words, David?
Why are you way over there?
I'm trying to find the SIS.
Most of us have one over on the other side that's closer to you, so you don't have to reach over there.
Well, yeah, okay, alright.
Should do both sides at the same time.
I'll say right there, more or less. Yes?
You're done?
No, I'm not done.
Please look at what you're doing, guys. Really, this is scary. Very scary, honestly.
You don't need to see the bottom, just that's the type I told.
Way to the side.
Mind you, he's a small patient. Average patients aren't small like that.
Easy.
What's your hip? I said wrong that area, Mr. Tees. I know I'm not correct, but there's my...
Who wants to do an AP hip?
Give it a shot. Esteban, give it a shot.
Esteban, go for it. This is incorrect, guys, really, because here's his image. Here's the image, and you know where his, if this is his image, the hip's way down here. Okay? He's got a beautiful crest and the upper part of his abdomen, but his hip joint's way down here, almost off of the film.
Wow.
Totally off. Okay?
His foot.
And this foot, right, wasn't inverted. Okay, so again, this is a total repeat.
You just said you just corrected everything, right?
But I didn't say it how to do it correctly.
Alright, so I'm gonna palpate your hip real quick. Sorry.
What are you eyeballing, sir?
I'm sorry?
What are you looking for?
I'm just trying to match the collimation to like the edge of the collimation to the hip. I mean to the
Okay.
ASIS. And I want to invert the leg. Could you move your toes inward? And I'd shoot that.
Okay. Excuse me. Okay, top of film at ASIS, right? That means his hip again is going to be way down here. It's a little bit better, but again, on a hip, guys, top of film at ASIS. Center the tube. Slide in a little bit. On hip, again, so that on your film, if the top of the film is at ASIS, his hip is way up here and you get all that femur. Okay, you don't want to have the hip joint way at the bottom. Okay, again, feel ASIS, top of film at ASIS, center the affected hip, you're done. Maybe even give them half a shield. Yes? So ASIS for hips, guys. Crest for pelvis. Yes or no?
Where do you put the shield?
I was gonna ask
Half.
if you think the
Just
half
half.
is Danny?
Half. Go on. No, that's crest. This is ASIS. This is crest. That's ASIS.
You'll see it better when you do your S
You have to palpate. These palpation points are going to be very important. It's going to be also important when we do lumbar spines.
She's doing it on a big patient just so they can see how.
But it's going to be same.
No.
You're still, yeah, it's not going to be.
It's more protruding on that.
It's more protruding on him. The larger the patient. Still, when they're laying down, you still can assess. It's about 2 inches below crest. Okay. What are we going to do on a frog? A 4. Who said a 4? Joe, come and do a frog.
So the one at the elbow,
Lengthwise always, not this way. And those are good things. When we get to the lumbar spine, because that's really where centering is going to be a problem. You can't feel pressed on one patient. You should find other landmarks, belly button, elbow.
So that would be basically the foot touching the knee.
Okay, talk to your patient.
Okay, would you mind touching the bottom of your foot, touching your knee? This knee right over here.
Or it's much easier, just like they said. I need you to do a 4 for me, please. And demonstrate to them,
Can you do a
right?
4 for me, please?
Yeah.
That's that easy.
Hey, slow down. Slow down. Number 4.
We're doing the left.
And then touch your nose. I said ABCs.
Slow down.
are you doing the left?
That was the left.
Oh, it was a left.
Yeah, the other left.
Okay, sorry. So actually, can you move this back up? Okay. And we're gonna do the same thing. It's gonna be. Okay. Yeah. Are you comfortable? Is that okay? Okay. Awesome. Oops. That's a bit more. Okay. All right. So,
Them moving.
I just farted. No, I'm just kidding.
I didn't think you'd do that, Katrina.
that's a nice way to break up the.
Okay, let's go home.
Okay. So.
What do they say?
That's aligned.
Yeah, he's doing that.
Okay. And I always take too much time. Actually, no, that was good. What am I doing? Okay. And let's see. Sorry. To the down here to the ASIS, because that's the
The top
crest.
of the film? Okay.
Right, because that's the crest.
I'm gonna suggest, don't rely so much on the light, because
Okay.
oftentimes you guys have the light larger than the size of the cassette,
Mhm.
okay?
Well, isn't it supposed to be the size of the cassette?
Yeah, but I can do this,
Okay.
and you guys will when you start clinic, so I'm gonna say, don't rely on the light, I'm gonna say, go by the cassette. Because
Okay.
inevitably, you guys always have it a little bit further open than really the size,
Yeah.
okay?
I always do that.
And then now what we're gonna do is move the collimator, ours doesn't, to go the way his femur's going. And then just half a shield.
It'll get on the IR.
Yes, it will, it
And
will.
you said-
It'll come diagonally on your IR.
You said most clinics will allow you to.
Can you do that, sir? Guys, I have a question for you. I am so concerned. Can you guys really do this when you're at clinic and doing Bucky work?
No.
You cannot. You cannot do that.
Because that'll mess. Okay.
You,
yeah.
you get grid cutoff, and
Right.
we're going to learn about that next week. Chapter 12. You cannot do this. Remember I said, when you do Bucky, the first thing you should be doing is centering to here.
Right.
Okay, you cannot say, oh, okay, I can move the tube this way. Oy.
It has to be centered.
Yeah,
It's
because then
gotta
you're
be
totally
centered.
off. Okay.
So the only time you do that is to center it.
You're good.
Exactly.
Okay.
And if
Yeah.
the table doesn't work.
Okay. Yes or no?
Can we have
Do
Nicole
you push
do a
them
sunrise?
to the side?
I'm sorry?
Do you push them like laterally?
No, you don't need to.
No? Like that?
That's fine.
Yeah.
Okay.
Okay.
He can,
Yeah.
okay, guys.
Get away.